After 2 years behind a mask, they aren't going away just yet.
Any mask is better than no mask at all. I suggest at least a surgical level of mask right now and wearing it correctly.
Dr. Sarah Beth Hartledge from the Metro Department of Health says with record-breaking case counts from the Omicron variant, health experts recommend an upgrade from cloth masks to surgical or even an N95 or KN95.
It's not a new thing to be using them to provide that high-level filtration, but it's maybe a newer thing to be disseminating them out into the world.
Hartledge says each type offers different protections. Cloth masks were fine when community spread was low, but the Omicron variant's transmissibility warrants a better shield.
The other thing that varies about all of these masks is the cost. I paid $12.50 for a pack of 5 of these cloth reusable masks that you can wash and reuse. For the disposable masks that have to be thrown away after one use, it was about $15 for a pack of 50. And for that all-important reusable KN95 masks that are good for a few wears, I paid $5 at a local hardware store.
If you see them and you need them, you might just grab a few.
At local hardware stores, you can still find the more resistant masks, though that wasn't always the case.
A year and a half, 2 years ago when it first started, they were very hard to get, and just recently, I'd say within the last 6-8 months, we've started to get them back in.
The good news for your wallet, they're a bit sturdier than the one-use surgical masks.
They're not infinite, but you can use them for several days or perhaps a week or more if you're not wearing them all day.
Hartledge says if a mask is soiled or wet, it's time to throw it out. And she always recommends her Swiss cheese protection plan.
Do the best we can at each level so that if something slides through one level, that hopefully the next level will catch it.
Vaccination, masking, and distancing, layering up to push back against Omicron. In Louisville, Grace McKenna, WHAS 11 on your side.